Hi guys, I'm Zainab from KMA Therapy and I'm with you all today to talk about what are panic attacks. Now before I begin to tell you all what panic attacks are, how to recognize its symptoms and when to reach out for help, I would definitely encourage you all to take a look at my earlier video on anxiety. You will find a link right above which will help you to take a quick peek into what is anxiety, and it will actually help you understand this video on panic attacks way better. So let's get into what panic attacks are. Now panic attacks are nothing but brief periods of overwhelming fear or anxiety, and the intensity of panic attacks go way beyond anxiety. Now when a person is experiencing panic attacks, they almost feel that they're having a heart attack, fear of dying and not able to breathe. And these symptoms can feel very scary, but it does not cause you any physical harm. Now when panic attacks, usually they are very brief but very intense. So it can last from anything between 10 minutes to 30 minutes, but the symptoms can linger for over an hour. So let's look into what these symptoms of panic attack look like. First is heart palpitation, shortness of breath, trembling or shaking, fear of dying, a sense of going crazy, muscle tension, nausea, chest pain, and also sweating. Now these are all symptoms of panic attack. Panic attacks can occur unexpectedly, whether you are in a calm state or an anxious state. Therefore, it becomes really difficult to understand what the causal factor is. There are certain people who understand what the cause of their panic is, but there are yet others who are not able to identify what is causing them to feel panic. Therefore, a lot of us get really preoccupied to manage those symptoms of panic. Now, in managing those symptoms of panic, we are not able to understand what the underlying issue is. Now, the underlying issue can be just tied down to stress or major transitions in your life, whether it is graduating from school, getting married, having a baby, or entering a workspace. Or it could be severe stress. That could be handling a divorce, loss of a job, or even death of a loved one. Now, imagine if we are constantly just trying to manage the symptom of panic, we are not getting to what the underlying issue actually is. Let's look at this diagram. Now, I have put down few factors which tend to increase the cycle of anxiety and panic. Now, imagine if you are going through a trigger, which is where you're feeling your lungs are tightening. Immediately at that point in time, you have perceived a threat. That is, I won't be able to breathe. The minute you are telling this to yourself that I will not be able to breathe properly, I am getting into that zone of panic. The minute I reach here, the bodily symptoms tend to increase further. That is, not being able to breathe correctly, or dizziness, heart racing, sweating, cold sweats, muscle tension. The more the bodily symptoms increase, the more you are catastrophizing the whole thing. So you are having a lot of unhelpful thinking styles. That gets into I will suffocate to death. The more you are engaging in this thought process, you now want to move out of this zone because it is very scary to be in this entire cycle. So what do you do at that point in time? You choose the behavior that is avoidance. Let's say exercising. If you find your heart racing rapidly when you are exercising, you will make sure you don't exercise. Now, when you stop exercising, you are managing the symptom, but you are not really managing the misinterpretation of the trigger that you have just gone through. Now, it becomes very, very important for us to break these cycles. If you find yourself in any of these cycles, or even if you find yourself experiencing a lot of bodily symptoms and trying to just manage that and are always fearful of having another panic attack, it would be time to reach out for help. So here at KMA, we have therapists who help you not just recognize symptoms of panic, but will also help you manage that effectively. We have 3 different locations that we operate from: Yonge and Eglinton, King West, and Liberty Village. And we also have Skype therapy. So I hope you found this video on panic attacks helpful, and I will see you all again next week with another mental health video. Take care. Bye-bye for now.